This video demonstrates the product features and design highlights of the Optima Turn, Well-L's pressure injury prevention solution for acute, post-acute, and long-term care. When placing the mattress on the bed frame, make sure the feet icon is on bed end to ensure proper direction of the mattress. Next, fix the mattress to the bed frame using the 4 straps on the mattress's bed cover. This prevents accidental displacement of the mattress. Once the mattress is fixed, hang the pump onto the bed end panel using the mounting brackets and connect the quick connector. After completing the setup procedure, connect the plug to the pump and then use the cable management flaps to organize the power cord with electrical power plugged, thus preventing tripping hazards for caregivers and patients. Check the CPR to make sure it is closed to prevent leakage and triggering the low pressure alarm. Flip the power switch, then press the power button on the front panel for a few seconds to initiate the pump. The mattress takes about 30 minutes to reach full inflation. Next, let's take a closer look to the user interface. Therapy modes to select alternating, continuous low pressure, or seat inflation mode. 3 turning modes include left, right, or left supine right turn. Turning angle to select light turn, half turn, or full turn, which represents 10 degrees, 20 degrees, 30 degrees. Pressure adjust levels to set mattress firmness based on patient weight. Cycle timer to select the cycle time for therapy mode, and dwell time for the turning mode, which will show on the LCD panel. Alarm and alarm mute key to alert caregivers of pump errors and temporarily suspend alarms. Power key to turn on and turn off the pump. Skin check button allows caregivers to quickly assess a patient for pressure injuries. Panel lock key to unlock the interface when the system automatically locks after 5 minutes of the last operation. Max firm key to inflate the air cells to maximal operating pressure. Basically, once the inflation is completed, you may set the pressure level based on patient's weight, and the mattress will provide proper pressure to deliver pressure relief. After the weight setting, you can then choose the desired therapy mode. There are multiple therapy modes you can implement for patient handling. Alternating mode is the system's default therapy mode and ideal for general care use because it ensures continuous support and minimizes prolonged pressure on any one area of the body, promoting comfort and pressure relief. Press the therapy mode button to select the alternating mode. Then move to the cycle time button to select the cycle time for 10, 15, 20, or 25 minutes. During alternating mode, the air cells underneath the patient are grouped into alternating sets. One set inflates to support the patient. The other set deflates in a repeating cycle. Continuous low pressure mode, or so-called CLP mode, distributes pressure across the body evenly to minimize pressure at the skin to mattress interface. Caregivers can use CLP mode when they need a stable, non-moving surface that still has pressure-relieving performance. You can manually select the CLP mode by pressing the therapy mode button. During CLP mode, all air cells maintain equal inflation, providing a steady pressure level adjustable for individual patient comfort. Seat inflation provides patients with additional sacral cushioning to minimize the risk of pressure injury development during sitting positions. Seat inflation is activated and deactivated by pressing the therapy mode key. During seat inflation, the air cells in the sacrum area will inflate to an optimal pressure based on the weight distribution of the patient to avoid bottom-out situation. Max Firm mode is suggested to support caregivers with patient transfer and care procedures. To activate Max Firm mode, hold the Max Firm button for 3 seconds. The mattress will remain on Max Firm for 20 minutes unless manually deactivated. During Max Firm mode, all air cells will inflate to its maximal firmness, which can provide a stable surface for caregivers to perform the care procedure safely. For one-time turning, press the turning mode button with selected direction and turning angle. Set the cycle time to 00. One-time turning is only available in either the left or right direction. For safety reasons, It will go back to supine position after 4 hours of turning. To cancel the routine, press either the alternating mode button or the max firm button. Doing this will return the patient back to supine position. For general turning mode, you will first choose the direction of left, right, or left and right for turning. Then choose the turning angle by press the button to select light turn, half turn, or full turn. After the setting is completed, press the cycle time button to select the dwell time. You will have 4 options: 1, 2, 3, or 4 hours. During the turning procedure, the mattress can offer alternating in the turning dwell time. To set this turning mode, choose the turning direction. Next, select the turning angle. And finally, set the cycle time of the dwell time for therapy mode. PFA, power failure alarm, with LED light and buzzer alerts caregivers of possible disruption to therapy care. To troubleshoot, check if the power cord is properly connected to a power source and if the power source is providing power. Low pressure indicator shows when the pressure level of the air mattress is lower than normal. To troubleshoot, check for the following. Quick connector is properly attached. CPR knob is closed. Inner mattress tubings are properly attached. Air hoses are properly arranged and are not broken. Tech support indicator displays when an issue occurs in the system and needs service. Alarm mute allows caregivers to temporarily suspend the audible alerts of the alarms for 3 minutes. Cleaning is crucial to prevent contamination. We recommend cleaning surfaces in a dry, dust-free environment. Use a damp cloth with mild detergent that won't harm the plastic casing to wipe down the pump. For the mattress, use warm water with mild detergent or chlorine bleach, followed by an approved disinfectant. The mattress cover can be removed for laundry and cleaned as specified by the laundry label. Air dry all parts thoroughly after cleaning before the next service. Before transporting the patient, caregivers should set the therapy mode to the continuous low pressure mode to provide optimal patient comfort during transport. Use the modes key to select CLP mode. After 5 minutes, switch off pump and disconnect the power cord. Then remove and cap the quick connector to maintain surface firmness. The mattress will stay inflated for up to 24 hours, ensuring patient safety and care quality. To transfer patient from bed to wheelchair, locate the side bolster deflation knob at the right side of the mattress end. Caregivers should deflate the side bolsters to create a leveled surface for the patient to sit and move from the mattress. The proprietary side bolster design simplifies drainage tubing management while also optimizing pressure injury prevention. The Skin Check button enables quick and thorough pressure injury inspection. Press the button once to start the routine. The mattress tilts left, holds for 1 minute, returns to supine, then tilts right and holds for 1 minute again. The routine finishes by returning to supine. Press the button again at any time to stop, and the patient will return to the supine position. If power failure occurs during turning therapy, to deflate the turning air cells, locate the tubing connectors at the right side of the mattress end and pull down the sleeve to find the tubing. Use the tags to identify the left or right turning air cell tube. Disconnect it to deflate. Caregivers can manually unclip and deflate air cells in the lower leg section to quickly offload pressure in vulnerable areas of the heels and lower legs, and custom pressure redistribution based on the needs and requirements of the patient. The single-handed CPR control is located at the head section. During emergencies, caregivers can quickly deflate the mattress within 15 seconds and administer first aid treatment. It can also be used to quickly deflate the mattress for storage, but should be closed immediately after full deflation. Optima Turn features mechanically controlled turning air cells to provide continuous, smooth repositioning. This helps caregivers avoid work-related injury caused by overexertion and forced body movements. Optima Turn allow caregivers to personalize repositioning regimen with turning frequencies, directions, and angles. This complete turning therapy management optimizes pressure, injury prevention care, and patient comfort. Optima Turn features side bolster design that improves the patient's safety and comfort during turning therapy. The additional cushioning protects patients from falling and feeling trapped or compressed against the side rails. Optima Turn comes with covers designed to resist water while remaining breathable, ensuring durability against frequent cleaning and chemical exposure. They incorporate antimicrobial agents to improve infection prevention, with additional features like watershed flaps over zippers to prevent fluid ingress and protection against bacterial growth along welded seams. Tailored for high-demand environments, ideal for facilities requiring rapid turnover and rigorous cleaning routines. We hope this video is helpful for you. For more information, please visit Well Well's website or contact your local Well Well's representative.